Tax credit premium subsidies are going to provide enormous relief for people who are trying to purchase health coverage on their own, but who are having difficulty right now affording it. What this does is these tax credit premium subsidies will pay for a substantial part of the premiums. And that means the remaining cost will be considerably less that people have to pay out of pocket. There are approximately 26 million people who will be qualified for these tax credit premium subsidies. And these subsidies amount to thousands of dollars each year. So it means that for people who've been uninsured, many of them are going to be able to afford health coverage essentially for the first time. And for those who are purchasing coverage directly today, increasingly they're finding those costs to be unaffordable as premiums have increased. This will provide very significant relief to them. The 26 million people who are going to gain the benefit of these tax credit premium subsidies are mainly in working families. This reaches deeply into the middle class because the tax credit premium subsidies are provided to those people and families with incomes up to 400% of the federal poverty level. So for an individual living alone, that's about $46,000 in annual income. For a family of four, that's $94,200 in annual income. So this reaches deeply into the middle class and moderate income people and families. So this is going to be enormously helpful for people who may be middle class or have moderate incomes, but because the costs of health insurance are so high, they're going to get the relief they need to make such coverage affordable. These tax credits are enormously significant, and they're unprecedented because the size of these tax credit premium subsidies will be in the thousands of dollars. Now, they are provided on a so-called sliding scale. And what that means is that those people who have the greatest need, they are going to get the greatest help. So these are people who are not considered poor. But when health insurance premiums have risen to $12,000, $15,000, this is a huge chunk out of their family income. And so they can't afford this health insurance without getting help. And these tax credit premium subsidies will provide that help and will very significantly reduce how much they have to pay. So they'll only be paying a small fraction of what they would be paying if these tax credit premiums were not available. As we've seen over the last decade, more and more people are being priced out of the health care that they need, and they just can't purchase health insurance. Increasingly, employers are either dropping health care coverage or they're diminishing what kind of coverage their workers receive. And so increasingly, a lot of working families are having difficulty getting coverage. And so as they try to go and get coverage in the individual marketplace to purchase private insurance, they're going to need help because the premiums, whether they're $15,000 for a family or thereabouts, those are simply unaffordable for a very substantial portion of America's working families. So these tax credit premiums provide relief to them that they've never had before, so that coverage is within reach and it is affordable. The first enrollment period begins October 1 of this year, 2013. And for this first enrollment period, it lasts actually pretty long. It lasts from October 1, 2013 to March 31, 2014. It's a 6-month enrollment period. In future years, the enrollment period is considerably shorter. It will be October 15th to December 7th. So starting October 1, people can start enrolling, and if they do get enrolled, they will start getting these tax credit premium subsidies starting on January 1, 2014. So the way people will be able to enroll, there are multiple ways. They can enroll online, they can enroll in person at these new marketplace offices, they can enroll by telephone. And in states across the country, there are going to be people on the ground who will provide assistance to people as they try to fill out their applications. These groups are called navigators and assisters. Bottom line, they are helpers, so that as people try to work their way through the application and they have some questions about how to fill out the forms, they will get help. Now, these navigators and assisters, these helpers, will also help somebody look at the various health plans that are arrayed in the marketplace to help them figure out which of these plans would be most useful for their families. You know, this is not the easiest thing to do because you've got to look at the price, you've got to look at, in addition to the premiums, deductibles and co-pays, what services are covered, which doctors are included in the plan, what hospitals you can go to. This will all be far more simple than it has been in the past because we're not going to have this fine print gobbledygook that most people can't understand. And plans will have to be described in plain language so you can compare apples to apples. But still, people who haven't had insurance in the past, or those who feel that they were befuddled by the fine print in the past, they may want some help. And so these helpers will be in states all across the country, and they will make this task a whole lot easier. The overwhelming majority of people who will be eligible for these tax credit premium subsidies are in working families. So of the 26 million people who are eligible for tax credit premium subsidies, over 23 million of them are in working families, which means at least one breadwinner in that family is working. In the next couple of months, people are going to learn about where they can apply for these tax credit premium subsidies. People will be able to apply online, they'll be able to apply in person, they will be able to apply by telephone. And in each state, there will be a different contact point. And so in the next couple of months, people will learn what that is. As these new marketplaces get created, there will be information about how you can get enrolled.